As a patient, when you go to the doctor and you present your insurance card and you go in for your 30-minute visit and you leave, you might think everything's said and done. Turns out it takes roughly 60 days for that practice to get paid.
For every $1 that a healthcare services organization is expecting to get paid, they're only receiving about 83 cents.
And that's as a result of fundamental fractures operationally that exist between patients, payers, and providers. Those systems traditionally don't speak well with one another.
If you're a healthcare services organization, the answer to your biggest revenue cycle challenges actually exists within the zeros and ones of the data that you're generating every day.
Adonis as a company seeks to build software to automate that end-to-end process where we can do it for a significantly cheaper cost, but making sure that we can maximize the amount that these providers collect. The way that we do that is we integrate with electronic health record systems. We also integrate with clearinghouses and insurance companies to make sure that we can get the doctor paid on time and appropriately. Prior to starting Adonis, my brother and I, who's my co-founder, we were working with some of the largest insurers in the country, helping them employ data science to improve the way that they underwrite claims at scale. And it wasn't until I happened to get injured in the New York City Basketball League, and as a patient going through the process of getting prior authorization and verifying my benefits and trying to get physical therapy access, I realized how broken of a process it was for me to get access to the right care. This experience wasn't just challenging for me. I learned that it was fairly cumbersome for the provider as well, who had to not only submit the right documentation to insurance companies, but also go through the game of cat and mouse to properly get paid.
Our platform seeks to improve revenue cycle outcomes through 3 core offerings. The first is an end-to-end billing offering, where our platform has automated everything from claim submission to claim scrubbing through denials management and enables healthcare services organizations to really hand us the keys to their revenue cycle operation. The second is a revenue intelligence platform. This platform was built based off the belief that healthcare services organizations are generating data every single day that, when studied and analyzed, can solve the biggest revenue cycle challenges that they have.
It's a one-stop cockpit level view into how your business operations are performing at any given time.
We've given CFOs, COOs, medical billing leaders access to alerts and insights that can help them understand their biggest opportunities of improvement, which ultimately drive better revenue cycle outcomes. The third is a series of technology-based automations, which, when deployed into a given organization, seeks to enable and enhance the existing processes and investments that organization has made, which includes automating the verification of a patient's insurance. It includes detecting underpayments, and can even include identifying and mitigating denials on the very cutting edge.
When we were first designing the Adonis product, we wanted to build for flexibility. We know that out in the market, there's hundreds of different systems, and the ability for us to create integrations to meet our customers where they are was really important to the speed at which we were able to provide value. Secondly, we knew that insurers change their rules all the time around what types of claims they approve and deny, and we had to build the best machine learning systems in the world to be able to understand those rules.
If you're a single specialty physician group and have traditionally outsourced revenue cycle to a third party, the job of our technology is to be broad enough and capable enough to offset and displace that existing third party and replace it with a tech-first solution to solving the most manual portions of revenue cycle.
Adonis is here to harmonize that data and deliver to you and your team the clear understanding of where you're performing well, where you're not performing well, what are all the opportunities for you and your team to capitalize on in order to increase revenue.
I wanted to walk you through one of our customers. They're a 3-location dermatology clinic that does roughly $10 million of revenue each year. Prior to working with Adonis, they were working with a local third-party billing firm, and it was really surprising to us that they were charging an arm and a leg, but only helping them collect 88% of the revenue they deserved. When we took over, not only did we drop that cost in half, we've historically helped them see a 98% net collection rate. When we first onboard any new provider onto Adonis, one of the first things that we do is performing a revenue cycle look-back analysis. And one of the things that has been eye-opening to us is that most providers are making the same mistakes over and over again. And so what we've built is a machine learning-driven pattern recognition engine that predicts those mistakes and then mitigates those mistakes so that providers can get paid a lot faster without having to spend time fighting denials.
The status quo is that healthcare providers have not been collecting the revenue they deserve, and that's a $52 billion problem.
Our mission at Adonis is to drive superior financial outcomes for our nation's caregivers so that they can shift their focus back to what they do best, which is drive better clinical outcomes and better patient experiences.
It's pretty mind-blowing that 1 out of every $7 spent on healthcare are spent on revenue cycle related operations. And it was really inspiring to my brother and I to actually solve this problem, because imagine if that 1 out of every $7 was spent on research or better experience or other ways to make the patient outcome more successful. That's why we're here every day, and that's what really gets us up in the morning.